Good morning, everybody. Thanks for joining us bright and early today. Today we're going to be talking about improving the care of our undocumented patients in our emergency departments. This is who we are, and we have no financial disclosures. So by the end of the talk today, what we want for everyone to take away is, A, that we want you to understand that immigration is an important social determinant of health, and it's something that we should engage with from the emergency department setting. We want to introduce the idea of language justice, the importance of mental health considerations amongst this patient population, understand that there are pathways to immigration relief that we can actually initiate from the emergency department setting or set in motion. And lastly, we want to lay out a blueprint for what an immigration-informed emergency department might look like. Most of today's presentation is we're going to be presenting some cases, and what we want is to have some takeaways from each case that you can take back to your own respective practice settings. But before we do that, I wanted to give a little bit of background information. So it's estimated that there's between 11 and 12 million people in the United States who are undocumented at this time. We know that people who are undocumented come from all over the world, but the vast majority do come from Mexico and Central America. If you look at this chart on the right-hand side, you can see that the number of individuals who are undocumented in the U.S. has substantially increased from the 1990s into the 2000s and plateaued over the last decade or so. There's a number of factors which contribute to kind of the ebbs and flows of migration, and we can't get into all the nuances of that, but I did want to highlight a few key considerations. The first is NAFTA, which is the North American Free Trade Agreement. It was passed back in 1994 between countries in North America, and the aim was, this is a neoliberal policy to promote globalization and decrease barriers to free trade between countries. The unintended consequence of NAFTA was that Mexico saw an influx of cheap or subsidized agricultural goods and manufactured goods from other countries, which essentially destabilized much of the economy. This resulted in a large-scale economic displacement of millions of individuals who often took perilous routes like this to travel northwards for better economic opportunities. The next thing I want to highlight is more recently we've seen the pandemic of violence in both Central America and Mexico related to gangs in Central America and the cartels in Mexico. So that's been a more recent occurrence. And then lastly, I just want to introduce the concept that status or someone's legality or illegality is something that's variable over time. It's not something that's fixed or concrete. Back in the 1990s, we know that millions of migrants were legalized into the United States. In 2012, we had semi-legal status given to recipients of DACA. And more recently, we've seen efforts to revoke temporary protective status for approximately 200,000 to 300,000 people who come from largely Mexico, Central America, and Haiti as well, who have been seeking kind of asylum from dangers in their own countries. But as healthcare providers, our focus often first goes to access to healthcare. What does being undocumented have to do with someone's access to healthcare? The important thing to know is that the Affordable Care Act, which was passed in 2010, was aimed at reducing the number of uninsured Americans. And it did that successfully through the individual mandate and expansion of Medicaid funding. But what it didn't do was cover those that are undocumented. In fact, it explicitly excludes that population. So what we see is, as the total number of uninsured Americans decreases over time, the proportion or the proportion of undocumented individuals in that uninsured pool has increased. As a result, you have an increasingly excluded and vulnerable population amongst the uninsured. The undocumented continue to rely on the safety net health system, which includes community health clinics, hospitals, and emergency departments that we all work in. Lastly, it's important to know that while people who are undocumented have been shown to utilize the emergency department more, overall healthcare utilization is less in this patient population. They account for about approximately 3% of the total U.S. population, but only 1.5% of total spending. But for the sake of today's presentation, we're not going to ground our discussion in political terms of legality or illegality or in cost-effectiveness analysis that might be used by economists. But instead, we're going to take the position of physicians, and we're going to be talking about the patients we have in front of us. And instead, we're going to use a framework of the right to health, which was put forward here in the International Covenant on Economic, Social, and Cultural Rights back in 1976, which states that there is a right of everyone to the enjoyment of the highest attainable standard of physical and mental health. So with that being said, I wanted to hop into the first case we have. just kind of lay the groundwork here. So we have Mr. JS. He presents to your emergency department. He's a 44-year-old gentleman. He comes in with a foot that looks like this. You do a quick chart biopsy, and you learn that he's been to the emergency department several times for diabetic foot infections, given PO antibiotics, sent out. He comes back within a few weeks to months. This is what his foot looks like here today. You talk to him, and he mentions that he has a history of diabetes and high blood pressure. He has no primary care physician. He's been out of his medications for a couple of months. So you think to yourself, my game plan is going to be a little bit of metformin, some antibiotics, and we'll send him out. And then you remember the presentation today, and you decide to go back and ask a little bit more about why he keeps coming back to the emergency department. You learn that through your conversation that Mr. JS is undocumented. He works as a day laborer. He says that his cycle of diabetic foot infections actually started during a workplace injury. He was at a job, a construction site. He didn't have the appropriate protective gear on. He had an injury to his foot. In addition to that, he says that because he's unable to acquire a driver's license, he has a hard time getting to his doctor's appointments. He's also facing what he says is an unfair eviction from his landlord. He thinks that he should legally appeal it, but he doesn't know who to go to, and he's just afraid to kind of expose himself to any scrutiny in the public. So that's what lands him in the emergency department over and over again. If we take a step back from Mr. JS's case, we can come to appreciate how being undocumented is very similar to, it's a similar scenario to this wall here. It's a very important social determinant of health in that, A, it first directly impacts individuals' health in the sense that it exposes them to conditions which lead to poor health outcomes. But in addition to that, it serves as a very functional barrier to services that are important for maintaining and sustaining our health. In this case, it might be access to health insurance, access to primary care, access to transportation, access to housing, or other social services that might be available to some of our other patients. So for that reason, what I'd like to, from my portion of this talk, is for you to take away the idea that immigration is a very important social determinant of health. The definition of social determinants of health is here. I'll read through it briefly. It's conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, resources at a global, national, and local levels. The social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status seen within and between countries. And I would make the argument that immigration is a unique social determinant of health because in our society, it's one of the few social determinants of health that's actively criminalized and persecuted in society, making it more difficult for us to identify this patient population and also provide the appropriate care. So with that, I'm going to hand it over